Good evening, everyone. Good evening to those in the US and good morning to those in India and other regions of the world. Thank you all for attending this important event today. My name is Euan Mowat, Neki's co-founder and COO. All of humankind has suffered tremendously for the past 15 months due to the COVID pandemic. Despite the best efforts of the global community and the unprecedented rapid deployment of COVID vaccine, many parts of the world continue to suffer. The recent escalation of COVID infection and loss of life in India has impacted millions of people that are in desperate need of help. Tonight, we are collectively doing our part in helping India recover from the current crisis by raising much needed funds. We have partnered with VNIT NAM, North American Alumni Meet Funds, Inc., Donate Cart, and Sevakitchen, all of which are actively involved in humanitarian efforts in the most deprived communities in India. Money raised will provide food to families that cannot work and will provide oxygen concentrators to boost the supply of oxygen to those in need. I personally, and we collectively, cannot thank you enough for your donations. Please share this fundraiser with your friends and family via social media. Together, we can create significant impact. I do want to note this meeting is being broadcast on other media channels. It is also being recorded, so those that cannot attend live or want to attend later can do that. So our panelists today include Dutta. He is the founder and CEO of Neki. Ron also happens to be a former classmate of mine from MIT Sloan. He is my business partner and one of the most generous and caring and giving people that I know. Khushroo, Poacha, founder of Sevakitchen, has spent a lifetime dedicated to humanitarian efforts. His current focus is to supply food and oxygen concentrators to those in need. Anil Kumar Reddy is CEO and founder of Donate Cart. He is also dedicated to humanitarian efforts in India. Lastly, but not least, Niranjan Bobde, an accomplished singer and performing artist, has also dedicated a significant portion of his time, money, and resources to helping those in need. I would now like to formally introduce Ron Dutta. Ron is the founder and CEO of Neki. He was born and raised in Nagpur, India, where he completed his bachelor's in electrical engineering from VNIT. Ron has lived in the US for the last 20 years and recently completed his MBA from MIT Sloan. He's an executive for a multinational financial services company. He was inspired by events during the early pandemic and founded Neki. Neki is a platform that creates goodness in society by empowering volunteers to fundraise for causes by donating their times and skills. I'm honored to have Ron today.
Thank you, Euan. Good evening to everyone in US and good morning to everyone in India. Euan, again, thank you for the kind words and the wonderful introduction. There is a saying, helping one person might not change the world, but it could change the world for one person. And that's exactly what we're doing here. Welcome everyone to our fundraiser hosted on the Neki platform, a platform to empower volunteers to fundraise for causes that matter to them. Our goal today is to create transparency in the giving process through this live fundraising event on Neki and to help COVID-19 patients in Nagpur and its neighboring cities, which are one of the hardest hit areas in India, with meals, groceries, and oxygen concentrators through our NGO partner in India called Sevakitchen and Donate Cart, which is an online platform collaborating with us tonight, which provides supplies to NGOs. We are so honored that you have chosen to be here and to be a part of this live fundraiser. And I promise an evening of inspiration, awareness, and soothing music. I would like to thank VNIT, my alma mater, in Nagpur, India, where I completed my bachelor's degree in electrical engineering, who have graciously partnered with Neki and allowed us to host this fundraiser to support such an important cause. Our heartfelt gratitude to three extraordinary leaders of VNIT Alum Association: Milind Gokarn, Director of VNIT NAM Funds Inc., Uday Kamath, Chairman, VNIT Alum Association, and Shashikant Chaudhary, who is a mentor to many VNIT students and alumni, for helping us provide support for VNIT students, as well as important causes like this, which is helping COVID crisis in India. So I just checked Neki, and you have helped us raise more than $1,500 in just 3 days for this cause. Thank you all for your generous donations. Your donations will go a long way in supporting our cause of helping COVID patients and their families in Nagpur, India, through oxygen concentrators, meals, groceries. So I want to provide a very brief summary of the impact that your kind donations can make. A $25 donation will help provide 10 full meals for a family of 2. A $50 donation will help provide 1 week's worth of groceries to 10 families of 2 people. A $100 donation will provide 1 week's worth of groceries to 20 families, or 40 full meals to families suffering from COVID-19. A $250 donation will provide 100 full meals to families suffering from COVID. A $900 donation will help save a life, potentially by providing an oxygen concentrator to severely suffering COVID-19 patients who are in urgent need of oxygen support. Imagine the impact that your donations can have. So COVID has hit close to home for me and has affected me personally. My parents live in India, and they had received their first COVID shot in the first week of April. And a few weeks later, my father called me and he said, well, they were ready to take the second shot. And he goes, well, your mother is having a little bit of fever. She's a bit fatigued, and she's not able to keep anything down. And I said to myself, that's not a good thing. So we got her tested, and lo and behold, we found that she was COVID positive. Now, at that moment, I felt, amongst other things, very helpless, because I was here, very far from them, and I literally couldn't do anything. I was not on the ground. I couldn't help. I was concerned about where she would get oxygen cylinders if she needed one. I was concerned about if she needed a hospital bed, if she would get it, who would help her. I was worried about my parents getting their meals, because she was the person who would cook in the household. But as I looked around, I realized that I wasn't alone. There were a lot of people around the world like me who have parents and loved ones in India who are suffering and are in similar situation. I have family and friends who have lost their loved ones to this deadly disease in US and in Nagpur, the city where I was born and raised. My wife just recently lost her uncle to the pandemic, and today would have been his marriage anniversary. Nagpur is one of the worst hit cities in India. It is time to take action, even if we can't be there in person. We need to do what we can to support organizations who are helping COVID patients and their families on the ground. This fundraiser is an effort to create transparency to support this worthy cause. Now, it's an absolute honor and privilege for me to have these 3 strong individuals and humanitarians with me tonight who are helping COVID patients and their families at this time of need in India. Khushroo Poacha is a renowned humanitarian and just an amazing human being that I've come to know in a few days, who has been serving the city of Nagpur for the past 20 years. He has been driving campaigns on the ground to help poor and needy during the pandemic. Anil Reddy is a VNIT alum, a friend, CEO of Donate Card, which is a platform helping people in need in India and NGOs, who is also one of the youngest social entrepreneurs in India and just an amazing human being. Niranjan, who is a young, highly accomplished professional singer, winner of Saregama Marathi, and a philanthropist, who is helping struggling artists right now in Nagpur, in India, who aren't able to feed themselves in some cases due to the scarcity of jobs in their field. Thank you, gentlemen, for being here with us tonight, and I'm hoping that together we can inspire people and create enough impact and transparency to help provide support for the needy in India during these trying times. Euan, back to you.
Wow. Thank you, Ron. So I'm going to continue the introductions of the other 3 amazing panelists tonight. So I'd like to introduce Khushroo Poacha. Khushroo, as Ron said, is from Nagpur and works for the Indian Railways. He's been a social entrepreneur for the last 20 years. He started IndianBloodDonors.com in 1999. This was the first helpline for patients who needed blood throughout the country. Witnessing firsthand a patient dying from lack of blood for a transfusion in hospital in Nagpur was his motivation. This helpline has saved thousands of lives in India. He then started Sevakitchen in 2014 when he saw relatives of patients admitted into hospital go hungry. Today, Sevakitchen serves more than 20 hospitals across the country. He has been a COVID warrior since the pandemic started and has been working on the ground in Nagpur and nearby villages to supply much needed food and oxygen concentrators to those most in need. Khushroo, thank you for all of your amazing humanitarian work and efforts, and welcome to Neki. Thank you. Go ahead, Khushroo.
Thank you. Good evening, friends in the US, and good morning to everybody in India. First of all, I would like to start with a small poem in Hindi. The poem goes this way. प्रभु कहते हैं होती आरती बजते शंख पूजा में सब खोए हैं मंदिर के बाहर तो देखो भूखे बच्चे सोए हैं एक निवाला इनको देना प्रसाद मुझे चढ़ जाएगा मेरे दर पर मांगने वाले तुझे बिन मांगे सब मिल जाएगा. वाह. Friends, India is going through a very bad phase and it's really very bad. And I am sure all of you have been seeing what has been going on, oxygen shortages, medicine shortages, and I don't know when this is going to end. We at Sevakitchen have been working since over a year. We started off by sharing groceries in Nagpur, across Nagpur. Now we have gone to other cities also in India. Like recently today, as of now, 1,500 kits are being loaded for a village called Pandav Kauda just now. And in the evening, we also sharing kits, 500 kits in near Gujarat, Amreli, thanks to our partners in Seva Donate Cart. So since the last year, not only we have been serving grocery kits, but we've been serving food. And now the situation is so bad that we are serving food to people who are COVID positive in their homes and they cannot work. And when COVID hits, it creates a lot of weakness in the patient, and especially senior citizens who just cannot do anything. So we've been serving them meals, and we've also been serving meals in big hospitals where there is a lot of overcrowding. There are so many patients that it's really difficult. People from nearby villages are coming for treatment. Oxygen is a very big problem. The cities were hit, and now it's the villages which are being hit badly. So we've been sending oxygen concentrators there. Just today, with our present consignment of 1,500 kits, which is just being loaded as I speak to you, we are sending about 4 concentrators back to them. So my gratitude to Donate Cart, who have been with us with Sevakitchen since the day they've started Donate Cart. My gratitude to Neki for helping us raise these funds today. My gratitude to all of you for your contributions. Thank you very much.
Heavy. Khushroo, thank you. I did not understand your poem, but I felt it and I saw the reaction of others. Someday I want to understand that poem. Sorry. I'm honored to now introduce Anil Kumar Reddy. Anil, sorry guys. Anil is a 26-year-old entrepreneur who founded Donate Cart in 2016 with a vision to bring transparency in donations. He has volunteered in many NGOs during college and realized the need to empower NGOs with fundraising. He also co-founded a startup named NewSpot while he was a student at NIT Nagpur. Today, Donate Cart has a team of 50 people and has helped over 1,000 charities in India. They've raised over $15 million worth of donations from 6 lakhs donors across India and in the US. Welcome, Anil.
Yeah, thanks, Euan. So that's 0.6 million donors, Euan. Yeah. So good evening, everyone in the US, and good morning for people who is joining from India. This fundraiser is really special to me because Neki, which is a platform started by Euan and Khushroo sir, who has been a campaigner with us from 4-5 years since our inception. It's a feeling where we are as a platform. That's what we are there, right? To connect donors who want to give, and then NGOs who can really channelize these donations. So Donate Card has started with this vision of really bringing transparency in giving. It's been started 5 years back from Nagpur. Fortunately, in my college, I happened to volunteer with so many not-for-profits. And one of the biggest challenges that I have seen in these organizations is that there are so many good organizations who are doing great work, but they don't know how to tell their story out to public and then maybe in turn raise donations for their work. So this has been a major challenge for a lot of NGOs. On the other hand, if you look at the giving culture in India, so Indians give 0.2% of our GDP to charities. So that's the value of donations that goes into charities, whereas in the US it's close to 2% of the GDP. So the giving percentage itself is so less in the country that you can't expect community coming together and solving their own problem, right? This has been a really big challenge, and we felt we can really bring in some change to it. If you look at our platform donatecard.com, the way we operate is to give this donor the trust in giving, right? Because what is stopping most of the donors to donate is the lack of trust in these organizations. So on our website, whenever someone visits donatecard.com, they get to browse multiple causes across the country, and they get to select what are the items that these organizations would need. Let's say if there is an old age home which is working with, let's say, 100 old people, they would be in need of blankets, they would be in need of groceries, they would be in need of adult diapers, so things like this. As a donor, you get to pay money for these adult diapers, you get to pay money for the blanket. Let's say a blanket costs $2, you pay $2 to Donate Card. Donate Card will use that money and buy this blankets from a vendor and ship it to the organization. So the idea is we convert donors' money into goods that are needed to a charity and then send those exact same products to the organization. So Sevakitchen exactly fits in the same ideology for us. I think from day one, whenever, if you look at Khushroo's philosophy, he doesn't take money at all from anyone. So, so there are so many such great organizations who don't need money, who just need resources to operate, right? So we help them getting these resources from people across the world. We bring this trust to a donor where they know that their donated item is really going to the end cause rather than to some other thing. This is a very powerful idea if you think about it. We really democratized giving in the country where you can donate as small as 1 rupee, or you can donate as small as 3 rupees You can just come onto a platform, donate a pencil, and then feel good about it. So the whole vision of Donate Card is really to encourage more people to give. And we are very fortunate to work with people like Sevakitchen. Till now, we have worked with over 1,000+ organizations, and more than 6 lakh donors have contributed on the platform. I think a majority of these donations have come into us in the last 1 year or 14 months. So COVID has had unprecedented impact on a lot of communities in the country. And so if you look at this first wave of COVID, I think the major challenge was more around hunger, right? Because of lockdown, a lot of people are unable to go out and do their daily wage jobs. So if you are a daily wage laborer who can only earn money once you go out to work that day, the challenge is to really get food on the table. There are so many organizations who have helped these communities. I think I am personally really encouraged to see the generosity in the country. We as a platform have grown more than 40 times pre and post COVID. So which essentially says a lot on the generosity in the country, and then the need for good charities or need for giving as well. The first wave, I think the majority of the work has been around providing ration to all sorts of communities, right? I mean, if you can think of, let's say, artists in Rajasthan. So tourists are not going to these places, so hence they have suffered. If you think about goshalas, so a lot of goshalas in the country operate on people visiting these goshalas and then getting donations from them. So we have supported so many goshalas. So if you look at any organization, also any not-for-profit, a lot of times they receive donations from people where they go and celebrate their birthday or a anniversary, and then they'll come and donate. So, but because of the lockdown, no one is really visiting these places, and no one is able to contribute. So I would say online has been a very good medium for these people to contribute. So a first wave, majority of the work has been around supporting communities to really feed themselves. No one really expected a second wave, and then the way this has happened also, I think it's really unfortunate, because we as a country had known this from long, but we couldn't prepare ourselves for this. But especially organizations like us who are not really doing anything in the medical space, right? So we are all organizations who have mostly worked on issues which are not related to medical, right? But this pandemic has made everyone to enter into the space, everyone to really do their own bit. A lot of work that has been done in the last 2 months has been around oxygen supplies. There has been really good contributions that has come from all sorts of people. But one of the major things that I would say has happened is there has been so much talk about it in the media that everyone really related to this problem. Whereas there are so many other social issues that really need that attention. So right now, if you ask me the current status of oxygen supplies, the need is definitely there. I mean, the need is going to be a lot more in the interior areas. But the bigger problem has been hunger, as always, right? Because you have so many people that that are there in the country who rely on these daily wage jobs, and then you really need to feed. You really need to find a way to feed these people. So oxygen supplies is one of our major areas. Also, we have got more than 1.5 lakh donors on our platform donating. I think a majority of these donations went on to oxygen cylinders, oxygen concentrators, oximeters, and other sorts of medical equipment. We are able to procure more than 1,500 concentrators from China, from Russia, and then imported them back to India, and able to support really meaningful work of helping someone get oxygen, right? So we have multiple models that our NGO partners are doing. There are few organizations which are working with the hospitals directly and helping them with the concentrators. There are few who work with these home quarantine patients and then provide them with cylinders or provide them with the oxygen concentrators, so that, let's say, they would need these concentrators for 3 days or for a week. They'll use it and then they'll give it back to someone who is in next line, right? So this way, it's a really shared community, if you think about it, where any donation is going to impact multiple lives. So if you're donating a concentrator, which means maybe you must be supporting at least 10 to 15 people in the next 2 months. So essentially get life-saving oxygen for them. So many causes that you can think of on the platform. So I want to thank Ron and Euan for doing this. This is very timely initiative from Neki to partner with organizations on the ground in India and then setting up a fundraiser like this. And again, it's a really proud moment for me being a student of VNIT. So I passed out 4 years back, and I met Ron a couple of years back in New York, and then I went to his house as well. So it's so surreal to see that all those connects, we are able to support some people on the ground. So yeah, back to Euan. Yeah.
Very good. Thank you, Anil, and thank you for the clarification on the laps. Thank you. Good. So my next introduction is going to be great. There's a lot of words here that I might not pronounce correctly, so forgive me. I will do my best. Our final panelist today is Niranjan Bobde. Niranjan is an accomplished singer and performer. He was a finalist of Z Saregamapa and the winner of ETV Saregamapa, both of which are prestigious talent competitions in India. He was awarded with the Nagpur Bhushan by the Nagpur government to recognize his impact to the city of Nagpur. Niranjan also runs the Swaratarang Music Academy and teaches music to 350 students. He also performs musical shows all over the world. Lastly, Niranjan was awarded with the prestigious Naushad Ali Award, which is a award based on a famous musical director and performer. Niranjan, welcome. Thank you, and thank you for all of the good work you do to support other performing artists.
Thanks a lot. Thank you. Thank you. Good evening to the US people and good morning to the Indian people. This is the first time I am indulged in a webinar regarding the charity work, and I feel fortunate myself to be a part of it. From of late, I guess 15 months, as I am in I'm an artist in artist field. The artist is one who may not know any other thing, or he's not professional in other things. He know only the art. So from past 15 months, due to this heavy pandemic, they are all sitting in a home doing nothing. And the worst part is he's the only person, the artist is the only person who is earning in his family. So his family is getting hamper. So from past 2 months, I got I started donating a kit of food and some money to them. But I didn't get any of the help from. I was doing from myself. But and I helped, I guess, around 50 to 80 artists. But the thing my dad told me 2 days ago, if you are doing a good thing, God will definitely help you in any of the way. And now I am attending the seminar. I can see the God in these people because God create some what we say, some measures, some area, something that will help your cause in a good area. So I think Mr. Ron and his team doing a great work, and I feel fortunate to be a part of it, and I can see much more help to the artists in the form of these gods. So really thank you for including me in this good cause. Back to you.
Good. Niranjan, thank you. Thank you for the kind words. Yes, we're all here to help support a major crisis. So, thank you to all of you, Khushroo, Anil, Niranjan, and Ron.
Thank you.
We're now ready to start our question and answer session. So for those of you attending this event, please, if you have any questions, please submit them at the bottom of your Zoom screen. There's a little button that will pop up and it says Q&A. Please submit questions via that bubble. I will try to organize the questions and address them to the panelists. Some of the questions, one of the questions that has come in is directed directly to Sevakitchen. Some of the questions that come in may not be directed, so maybe I'll throw the question out and we'll see which one of you wants to answer first. And if anyone else wants to contribute, additional comment, please do so. So, good. So this question is from Subhash. How do you, and it is directed to Sevakitchen. So Khushroo, how do you choose whom to provide help to? Can we contact Sevakitchen if we come to know someone is in need of food? You're muted, Khushroo.
Sorry. So, well, Sevakitchen serves irrespective of caste, creed, color, and status. As far as grocery kits are concerned, we have partners on the ground who connect with us. They tell us their needs, and we serve them with grocery kits. As far as food is concerned, we serve every day in hospitals, and we also serve COVID positive patients. People do connect with us from all over. We started serving food in Nagpur, Hyderabad, and Bangalore and Pune, but due to some restrictions in Hyderabad and Bangalore, we had to stop serving. But as of now, we are serving in Nagpur and Pune. And yes, you can connect with us if you need food for somebody in these two cities, and we will surely help.
Okay, very good. Anil, yeah, good.
Yeah. So I think Khushroo sir is such an amazing person. So he's like an helpline, right? He was just sharing it with us last time. So he picks up calls even if he gets it at 3 o'clock, and then if he's able to help someone. I mean, and he has good number of volunteers in multiple cities, which is obviously they have connected to Khushroo sir as a cause, and then they really go out and do their own bit. And many times, if regarding the food distribution, I think he have multiple initiatives. He's a very young person in terms of ideas, right? So he keeps getting so many ideas on how can he really scale the work. So there is something called Neki ka pitara, Khushroo sir. I really want you to talk about it because so the name really resonates to Dharan's vision. So
Definitely.
Yeah.
So thank you, Anil, for bringing it up. I completely forgot about it. So Neki ka pitara in 2014 when we started Sevakitchen. In 2016, I realized that we were serving the relatives of patients in hospitals. But what about the patients, the needy patients who are coming from big from villages to towns for treatment? They were not getting any sort of nutrition or anything. So we did a trial. We installed a fridge in a hospital, in the first hospital where we started service, and we called it a Neki ka pitara. Neki means the fridge of kindness. And we set up a team around this fridge. We made a WhatsApp group, and we made a team of about 25 to 30 people who would replenish the stocks of the fridge. So we would have juices, we would have milk, we would have coconut water, we would have fruits in the fridge. And every day the fridges would be opened, and the patients would take whatever they wish to. So from one fridge in Nagpur, we have 21 fridges across the country. And in big hospitals, Hyderabad has about 4 fridges, Nagpur has 5, Bangalore has 1, Naya Raipur has 1, Navi Mumbai has 2, Thane has 1, New Delhi has 1, Palwal has 1, Sawantwadi near Goa has 1. So, we have multiple groups filling up. We have even people from abroad, from the US, who fill up these fridges. Now, you will be surprised that how can people from the US, the Middle East, fill up these fridges? It's very simple. So we have, campaigns running on Donate Cart. We have people buying from Big Basket, Amazon, and ordering to fill up these fridges. And believe me, these fridges are never empty. They are full 365 days a year, and cancer patients, children suffering from cancer, children who have congenital heart defects. We work in a chain of hospitals in Navi Mumbai, Palwal, and Naya Raipur. They are the Satya Sai group of hospitals which conduct free open heart surgeries for children with congenital heart defects. So every day, post and pre surgeries, these children pick up a bottle of milk or a bottle of juice from these fridges and drink it. Cancer patients get free milk, free juices from these Neki Kapitaras. The Neki Kapitara is the most successful model of the Sevakitchen, and believe me, we do not accept a single paisa from anybody. In Sevakitchen, we say that taking money from anybody is the biggest crime you can commit. Even we do not have a bank account. People tell me, how can you sustain an enterprise without money? This is the biggest example of sustaining an enterprise, social enterprise, without money. And it's been 7 years now. So nobody can say this is going to fail. And Donate Card has been one of it. It fits, as I would say, it fits the bill perfectly. We have been working, and believe me, only just recently we completed one of our grocery kits campaign, which where people contributed over 1 crore. It's been a campaign where
God, that's
people have,
great.
yes, they have contributed over 1 crore to that campaign. Thank
So
you.
I think in that campaign, I just wanted to share. So we keep getting donations every single day, right? So there's not even a single day where we didn't really stop getting donations.
And
Sort of,
I
yeah.
and I would like to add to this that Anil and Donate Cart have ensured that they do not charge a single paisa on that campaign. This has to be mentioned. No commission on that campaign.
Yeah. Thank you, sir. I think we really want to see more people like you coming and using our platform. I just wanted to add on. So Euan was a bit emotional when he heard Khushroo sir. I think I keep receiving a lot of calls from the people in the States. So I received a call from a lady in Australia. So she was very emotional because what you can see is really visuals or videos, right, that are playing in media or that are coming in the news, and those are very, very heartbreaking, and especially thinking that this is for a country where you're born in, where you have your friends in, or where you have your roots, right? I think a lady called me up and from Australia, and she couldn't even talk to me. She was very emotional, and she was just telling that whatever we are doing is really needed on the ground, and she said she'll do her bit. I'm sure she doesn't need to call me, but the reason why she called up is really to see that, or to really thank us for what we are doing. So I mean, I am really, especially being an youngster, being in this space for only very few years, I'm really touched to see so many people connect to India, connect to this cause. So thanks a lot, Euan, and Euan and Ron for doing this. Yeah.
Very good. You're welcome. Khushroo, back to your point that you essentially operate without a bank account. Again, truly amazing. So this maybe is a great segue into a question. This question is from Shilpa. I hope I'm pronouncing that correctly. And she lives in Nagpur. She wants to donate, but she doesn't have a credit card. how can she donate? Now, I'm going to, so I think donating to Neki, through Neki, will be very, very difficult in Nagpur without a credit card. So Anil, Khushroo, I will let you address this question.
Yeah, number one, well, you need a debit card, a credit card, or maybe a Google Pay option for donating via donate card. But if you really don't have any of these, you can well buy supplies and send it to me directly. I can share my address or my phone number, and you can take it from the web, from the chat over here, and you can connect with me and send the material directly. But I'm sure if you use donate card for once, they have several options of payment where they can use Google Pay and Paytm. I'm sure you will be able to do it. It's very easy. You don't need a credit card or a debit card to make that payment. But well, if that is there, if you can they send the material directly to me and we'll accept it. At Sevakitchen, there is no minimum or there is no maximum. People say we will just give able to do something very little, but believe me that very little, it's like every drop makes an ocean. So even if you send me a meal for one person, I will accept it with gratitude.
Very nicely said, Khushroo sir. And I think it means a lot to people in Nagpur, especially people who are just looking to contribute in very simple ways. And I think making a phone call to you or just sending a meal or some groceries would go a long way as well for them.
Good. I love the analogy of a drop makes an ocean. So good. I did have a thought there, but I forget what it was. So yeah, that was my thought is, Shilpa, maybe I will email you personally after this event and make sure you are okay with me sharing your email with Khushroo. I don't want to, violate your privacy. And if yes, I will put you two in touch via email and let you take it from there. Okay.
I think phone number is the best. Let them.
The what? I'm sorry.
Phone number is the best. Mobile number, right? Maybe Khushroo sir, you can just type down your mobile number and then.
Yeah.
Okay. Yeah. I mean, Khushroo, if you're fine sharing that with everyone here, just put it in the chat window. Otherwise, I will send it to
24/7 helpline. Yeah. So I think his number is there on web already. Yeah.
Got it. Okay. Very good. Cool. And good. There's the number. So Shilpa, please take that down and get in touch with Khushroo and anybody else who is aware of people in need of help. Please feel free to contact Khushroo. And if there's anything Ron or I or Neki can do to help facilitate any of this, please let us know. We'd be happy to help. Next question has come in from anonymously. Can someone volunteer at Sevakitchen if they want to help?
Well, thank you. Yes, you can volunteer. You can start a Sevakitchen chapter in your city. But we are very, very, very careful in these times. Especially, most of our Sevakitchen volunteers are ladies. We do have male volunteers also at Sevakitchen, but at the moment, I am a little bit very careful of who I put to work where, because so many we don't want somebody to get infected and get unwell. So yes, you can volunteer. You can start a Sevakitchen chapter in your city. We have various initiatives at Sevakitchen, or you can join a Neki Kapitara. Yes, you can.
Very good. I assume that would be the answer. Again, I understand the need to be careful with who you put where, especially in the current environment. Yeah, I assumed you will gladly accept volunteers of any kind. So Good. Another question just came in from Prachi, I think. If someone wants to volunteer in a different city than Nagpur for food or any other deliveries, how can we associate?
Well, as I said, please get in touch with me on my mobile number. As I told you, we can start a Sevakitchen group in your city. It's very simple. You just spread the idea about Sevakitchen amongst your friends. We have various initiatives. If you go on the Sevakitchen website, you will see different things which we do. Start a group, start small, and you can start a chapter. And yes, we can connect with you of what you can do in your city. It's very simple.
Very good. Okay, so last call for questions. I don't believe I see any. So I'm going to wrap it up. If any questions come in, I'll interrupt myself and ask them. So I'll tell you what, this was very profound and moving for me. So thank you all. Thank you, Anil and Donate Cart. Thank you, Khushroo and Sevakitchen. Thank you, Niranjan, for all the work you do with fellow artists and performers. And thank you, Ron. Thank you all for donating your time tonight. Very special, and everything you are doing really makes a difference. And I will use that drop ocean metaphor for the rest of my life.
All my pleasure.
Yeah, good. So thank you again for donating your time to host this fundraiser to support the current crisis in India. Thank you also to VNIT NAM for enabling this fundraiser to take place. Again, I can't stress this enough. Thank you all for all of the good work you do. I would also like to extend a very, very special thank you to all of you that have attended today, and to those of you that have donated today that may watch this recording in the future. So again, thank you for your donations to this important cause. We encourage you to share this event with friends and colleagues. Again, it is being recorded. The event page allows you to easily share events on your favorite social media platforms. Together, we can and will make an impact, and we will make the world a better place. Truly, from the bottom of my heart, I wish you, your families, your friends, your colleagues, the best of health as we battle this pandemic. So again, sorry. Thank you all. Have a good day. Have a good night. Thank you.
Thank you.
You're muted, Ron.
I'm sorry. Thank you so much, everyone. Really appreciate it. Niranjan, it is an honor for me to have you on this platform, and we couldn't let you.
All my pleasure. My pleasure.
Without singing a song or two, if you don't mind, if you could dedicate some songs for
yes, definitely.
patients and their families, it would be very kind.
I would really like to dedicate a song.
Thank you.
So it's a famous and basically on the current situation, a very motivational one. I hope everyone can hear me.
We can
Hello.
hear you. We can
see
yes, we can hear you and see you now.
Okay. Oh, you can hear me, but you can't see me because I'm seeing the lyrics over here.
Okay, got it.
Sorry for that.
No worries.
Yeah. इतनी शक्ति हमें दे न दाता, मन का विश्वास कमजोर होना। इतनी शक्ति हमें दे न दाता, मन का विश्वास कमजोर होना। हम चले नेकी रस्ते पे, हम पे दूर कर भी कोई भूल होना। इतनी शक्ति हमें दे न दाता, मन का विश्वास कमजोर होना। हम न सोचे हमें क्या मिला है, हम ये सोचे किया क्या है अर्पण, फूल खुशियों के बाटे सभी को, सबका जीवन ही बन जाए मधुबन, अपनी करुणा का जल तू बहा दे, कर दे पावन हर एक मन का कोना, हम चले नेकी रस्ते पे हमसे भूल कर भी कोई भूल हो ना, इतनी शक्ति हमें दे न दाता, मन का विश्वास कमजोर होना, मन का विश्वास कमजोर होना. Thank you.
That was beautiful. Thank you so much.
Amazing. Yeah.
Thank you. Thank you.
Thank you. So again, thank you everyone for your time tonight. Thank you for your donations. Thank you for caring. Thank you for your support.
Thank you so
Thank
much.
you.
Good night.
Have a good night, everyone. Thank you.
Thank you.